Hello. We're in Chattanooga experiencing a little upsurge of the new novel influenza A, also known as H1N1 or swine flu. We've started seeing more cases since school started back and children are in close contact with one another. And I think that the absenteeism and the fear of a new disease has caused people to have a great deal of anxiety when their children start to run fever. And I'm really here today just to reiterate the CDC message that as of right now, the new strain of influenza A is not showing us there's no hint that this is any more severe than the usual seasonal type of influenza that we're all familiar with. So right now the symptoms of the novel influenza A are just like any other flu. They may start off with fevers, muscle aches, headaches, sore throat, and then runny nose, cough will develop. And some children will also have vomiting and diarrhea. Children that are in any way fragile, that is, they may have a chronic illness such as diabetes or cerebral palsy, chronic lung disease or heart disease, those children are at risk of having a more severe course when they catch any type of influenza, not just this one, but any type of illness. And those children should not wait too long to go see a doctor. So if you have one of these more fragile children, they need to see a doctor early rather than late. On the other hand, if you have a healthy child and they are having symptoms of fevers and these other things that I've described, and they are still drinking and interacting and playing, they probably don't need to go see the doctor right away. There has been some anxiety on the part of parents, and we've had a lot of children come to the emergency room with fevers of as short duration as 4 hours. We can't even really tell at that point what is wrong with your child. And they're still healthy, drinking, eating, running around, playing. There's not going to be any treatment given for those type of children because this is a virus, and the only way to get over it is for most children is to just let it run its course. There is treatment available for children who are more severely ill or who end up in the hospital. We do have a drug called Tamiflu that is very effective for this kind of influenza, but most children don't need it. We're also not going to test every child that comes to the emergency room or to your doctor's office with fever for influenza because at this point it is a mild illness. On the other hand, if your child is sick enough that they have to be in the hospital or get admitted to the intensive care unit, then it's very important for us to establish, does your child have the new strain of influenza or one of a number of other viruses that children can get at this time of year. I think if your child has got an exceptionally high fever or is not drinking or appears to be having trouble breathing or is listless, like not running around, not playing. I mean, any child with fever is going to have less activity than normal, but there's a difference in a child that you just can't, they're not interested in doing any of their normal activities. Those children probably should see a physician. On the other hand, if your child has a runny nose, cough, low-grade fever, but when you offer them something to drink, they can do it, they're not short of breath, they probably can let this run its course. Well, early on during influenza, you can see temperatures of 102, 103, but I think if the fever's been 102 and 103 and then it's down to 101 and it's 100, and it suddenly goes back up. That, for example, is unusual. So the fever usually is the highest during the first couple of days of the illness, and then you expect it to start coming down. And the worry about fevers that come back after it seemed to have been going away is that you might have developed a secondary bacterial infection. So people that have had influenza do have some, it damages the lining of your throat and the lining of your lungs, and you're more susceptible to bacterial infections. So that might be one clue to to that being a complication of influenza. That is a group that's always a group that we see a lot of influenza in because they're socially interactive. So they're clumped in classrooms or other areas together, and they're more likely to pick up any influenza. But it is true that we have seen some of the more serious disease in younger people than in the very aged population that we often see severe influenza with. But so babies, however, are also going to be particularly vulnerable. Yes, Tamiflu is a medication that's been available now for several years, and it treats most types of influenza. And the good news is it does treat this strain that we're currently seeing. But it's not necessary for everybody that gets influenza to take Tamiflu. Fever for perhaps 3 days or possibly 4, and then the coughing and runny nose stuff takes longer. So the first few days you have muscle aches, sore throat, that clear runny nose and coughing, and then that all clears up the aches and pains and fever, but you're going to continue to have the respiratory symptoms for a little while longer. But the recommendation right now from the CDC is when you've had no fever for 24 hours, that you are minimally, if at all, contagious, and it's okay to go back to school or work at that point. Well, you can be contagious actually 24 hours before you have the fever, so you might be walking around potentially spreading virus before the symptoms actually get started, but certainly from the time that you develop fever until the fever's been gone for a day, that's the period of where you're most highly infectious. We're encouraging everybody to teach their children to, we should have lots of tissues around. Grab a tissue, make sure when you sneeze or cough that you're covering your nose and mouth. Dispose of that tissue in the closest receptacle, and then use hand sanitizer or wash your hands to get the virus off of your hands. And we should all wash our hands frequently, since although the most common way to spread influenza is for people to cough and sneeze into the air, and then these like little mist particles that are expelled when we do that are breathed in by the next person. But they can also land on a hard surface, and virus can stay there for 2 to 8 hours. So if you come over and touch something and then touch your nose or your eyes or your mouth, you can actually inoculate yourself that way as well. Antibiotics will not help one bit for influenza. Now, if you get influenza, you can get, in children, ear infections are a common complication. 7 or 8 days down the road, if you're not any better, you might have sinus infection. You can get bacterial pneumonia. Then you might need an antibiotic. But during the early stages of influenza, antibiotics don't make any difference, only for the complications. The emergency room, unless the child is dehydrated, not drinking, having trouble breathing, those are the type of symptoms for which you need to bring your child to the emergency room. Pediatricians would probably say if you're not getting better after 2 or 3 days, or you're worried about your child, and for certain, any like infants or children who have problems that make them more susceptible to having trouble getting over influenza, they should see their doctors on the early side rather than later.